If you're watching this video, you've made the decision to proceed with cataract surgery and you're preparing for your surgery. I wanted to take this time to go over what to expect and what you need to do in order to have a successful cataract surgery. It is important that you've had all of your questions answered and have made all of your choices at least a day before surgery. If you have confusion or questions or concerns, please contact our office and we will provide you the information you need to be prepared. Eye drops are an important part of cataract surgery and a frequent source of questions. You will be given 3 different kinds of drops, and their names are prednisolone, Cataract, and ofloxacin, unless we choose to substitute for an individual reason. Each drop will go in 4 times a day, starting the day before surgery, and continue until we ask you to change that routine. The eye only holds 1 drop at a time, so if you put 2 in, you will not get a greater dose. If you're not sure if a drop went in, you're free to put a second drop in. You should have ample supply unless you miss a lot, and if you do run out of a drop in the first week, please call and we will have another prescription sent in. The prednisolone drop is 10 milliliters, which is twice the volume of the other 2. You need 10 milliliters of prednisolone because you will be using it for up to a month. Sometimes pharmacies will give you a 10 milliliter big bottle, or they will give you 2 small 5 milliliter bottles. Either is fine. If the pharmacy only gives you 1 5 milliliter bottle of the prednisolone, that's not okay and you should notify us. All the drops may sting, but the Cataract stings the most, and this is normal. You don't need to be worried about that. It is important for you to place your drops in your eye the day before surgery 4 times a day. You'll continue this routine for an entire week, right through the surgery. Please allow at least 5 minutes and preferably 10 minutes between drops. The first medicated drop that goes into the eye needs time to absorb before it's washed out by the second. You should devote the day to cataract surgery. Although it is a fast and easy surgery, it requires that you not eat for a good part of the day, have a driver, you will have sedation, and it is important that you follow the instructions, which will be to take your drops as we described 4 times a day, and to use the shield as well as avoid strenuous activities. After routine cataract surgery, it is entirely normal for the eye to be quite blurry for many hours, as well as have some level of discomfort, foreign body sensation, and irritation. Most patients describe the pain level on a 1 to 10 scale as 4 or below, but many report having very poor vision initially. However, you are free to go about your routine activities once home, such as reading, using the eye, watching television. Although we ask you not to eat 6 hours before your surgery, you may take your routine medications. This does include blood thinners, a frequently asked question. As the surgery is bloodless, we do not stop any medications with rare exceptions, and we'll tell you about those. Also, if you're a diabetic and take insulin, we recommend you take half your normal dose, as you're not eating. Once you arrive at the surgery center, you will be checked in by the nursing staff who will check your vital signs and prepare you for surgery by dilating your eye. I will meet you in that preoperative area and answer any questions or go over any last-minute issues you would like, then meet you in the operating room. Your awake, painless procedure will take about 15 minutes, after which you will go to the postoperative area where your vital signs will again be monitored until you are safe to go home. The whole process, again, can take somewhere around 2 hours and up to 3 hours. It is important for you to bring your drops and any questions to each postoperative visit, as well as any relatives who are helping you through the process. Again, there is significant information involved in this process, and it is helpful to have everything in the room when we meet to sort out any kind of questions you have. Successful cataract surgery can result in very different vision, especially in the early days after cataract surgery, depending on the person's eye, their goals, or their lens implant type. Also understand that you will not have your best vision until glasses are made for 1 month. This may leave you visually disabled, and we will inform you if we can anticipate this expectation. Patients who are choosing a distance aim with their eye and achieve that goal will have good distance vision but be blurry at near with that eye. Patients who aim their eye near will be clear at near and be blurry at distance. Once glasses are made, the eye's vision will be maximized as sharp as possible, and it will be maximized in terms of range. And that eye, with the help of trifocals or progressives, will be able to see distance, intermediate, and near, but you will not have that vision until the last critical step when glasses are fit. Now that we've gone over what surgery is like, it's time to actually have the surgery. I look forward to meeting you at the surgery center and performing that surgery for you. I think you'll find it's fairly easy to go through. And afterwards, we'll be showing you more informative videos about what comes next. Thank you for choosing BMC for your eye care.